Good morning, everyone. My name is Janos J. Prasad Samuel. My student ID number is 300-23248.
Hello everyone, my name is Kajal Chaudhary and my student ID number is 300-26837 and we are student of Infection Risk Management.
Today, we are going to present our PowerPoint presentation, which is COVID-19, and we are going to look at the topics like potential threat, how the healthcare workers they are getting infection from COVID-19 patient, and how it is going to become a potential threat for the future, and how it is going to make an outbreak. And the second slide, we are going to critical analyze for how the healthcare workers they are getting infection from COVID-19.
Okay, and in the next slide we will discuss the guideline and the standards related to the infection risk management and the COVID-19 plan. It will related to our outbreak plan which will made by us, and in the next slide we will discuss the evaluation strategies which will give the positive outcome from our COVID-19 plan which was made by us in this according to COVID-19.
Now we are going to look at the potential threat. The first line is healthcare workers are the one who's walking near to the COVID-19 patient, especially doctors and nurses. And a long et al. 2020 study shows that healthcare workers, if the healthcare workers, if they get infection, this is going to become a potential threat for the future, that he found out this in his studies. And the third line says healthcare staff may be at the risk infection, which will cause an epidemic in community and hospital also. So here is the critical part. Why COVID-19 is a possible threat and frontline workers are more likely to become infected with COVID-19. A study conducted by Long et al. In UK and America. What happened there when he found out there are a lot of things he found out in the hospital and aged care sector. The healthcare workers, they have no idea how to use the PPE and they don't have a good quality of PPE, and they started using the PPE reuse. So because of this, many of them, they started getting infection in the aged care setting and clinical setting, especially in the aged care settings. And poor quality of PPE. Because of global rise PPE equipments, they started getting the poor quality of PPE from worldwide. And working in the clinical setting, especially working in the hospital, this will increase the infection double than the aged care settings.
I'm going to continue with this critical analysis again, and according to the Wang et al. Study, healthcare workers do not have the enough and strong knowledge about the PPE, so they do not how to use PPE, so sometimes it leads to the infections and long exposure, because we can see that worldwide because of this outbreak we don't have the enough healthcare workers, so healthcare workers do the extra duty and sometimes they spend their more time with the patient, so this is one of the reasons. And the rest among the healthcare workers when they do the extra duty, so they can't take the proper rest, and sometimes it can make them sick and make their immune system lower, and the demand of PPE has increased worldwide because of the increase in COVID cases. We don't have enough PPE to worldwide to provide the healthcare workers. Sometimes healthcare workers do work without PPE, or sometimes they reuse their PPE, so it can directly lead them to the infections and the work pressure. In the work pressure or workload, they sometimes forgot to wear PPE equipments like the gloves and mask. So this is one of the reasons which can lead them to the infections, and inadequate training in the infection prevention, control and management. So in this COVID situation, healthcare settings and clinical settings, there are some hospitals hiring the new staff for the patients, but they do not have the time in this outbreak to provide them proper training. So this is the main cause. We can say that it can make that infected. The second thing is the healthcare workers work when they were sick. So the healthcare workers do not have the choice because of the less number of healthcare workers we have in many facilities. So they like work during they are sick. So it can make them sick because of the less immune system and. Lack of training during the treatment, so they do not have the proper training like how to handle the patient and how to handle the infections, like they work, sometimes they work and they do not know the proper practice, so they can get infected. And the community risk, do not maintaining the social distance. So according to the Cheng et al. Study, sometimes after completing their work, the healthcare workers directly go to the parties, and sometimes if they are infected, so all peoples are party, they will directly get the infections and it will create the cluster. And nosocomial transmission to the hospital. Nosocomial is the common infection, so they can get this if they do not use the proper practice. And the lack of attention when they collecting the samples, so sometimes they do not how to handle the samples and how to collect the sample, means they do not know the proper practice, so that's why they can get infected.
This critical analysis done by Anna et al. 2020. She has also done the critical analysis related to healthcare workers. Why healthcare workers they are getting infection from the aged care settings. She has also found often reported a lack of knowledge about the PPE and scarcity. So here the staff they have no idea about the PPE and also the scarcity of the PPE. And what we have found in other article also, they saying the same thing, the lack of knowledge and scarcity of the PPE. The same thing she has also found. And workload resulted in infection exposure among healthcare workers. So the work load has increased after this pandemic for among healthcare workers. And poor hand hygiene among healthcare workers. Most of the staff, when they are busy, they forgot to do this hand hygiene because they thought this is not much important to give care for the patient. So this is happening in all aged care settings, even in the hospital. And procedure for aerosol procedure, which is the important procedure when we are giving treatment for the respiratory tract infection patient, those who has ventilators and tracheostomy, those are the people they can easily spread the infection to the staff or also nearby patient, especially in the ICU setup. So when we are giving treatment for those kind of people, we have to follow the infection control protocol exactly what the hospital taught us. So the aerosol procedure, it's a very important procedure. Anna et al. Has found here this is the main thing to spread the infection, COVID infection in the hospital. And late diagnosis of COVID-19, inadequate renovation of the air. Late diagnosis, this is happening nowadays because there are a lot of patients, they are coming in the hospital and we cannot do for each and every patient at the same day. So when we do the tests late, so it will become a problem for the staff and also the patients. And inadequate in renovation of the air. This is the main issue in the hospital when they are not maintaining the air ventilation system properly. So Anna et al. Has found about this also in her studies. And this is the risk factor Anna et al. She found in the hospital, which are the highest risk factor to get infection for the healthcare staff. The main thing is lack of PPE, which is 42.5%, higher among all other infection. The remaining thing, hospital associated infection and also aerosol procedure and COVID-19 late diagnosis, lack of PPE and poor hand hygiene, negative pressure, all of the things are 7.1%. Apart from that, work pressure and load, this is 14.2%. So the main thing is lack of PPE and work pressure. Infected cases and death in healthcare workers. The healthcare workers who got infected and died in this pandemic. So here when we look at the date February 11, 2020 in China, only the healthcare workers got affected 1089, which is 88% from the whole population, and the death is 22. And April 16 in Italy, 17,306 healthcare workers they died, which is really high in this table. February to April in United States of America, 9,282 healthcare workers they died. In April 11, 2020 Australia, 159, which is very low in this table. And April 15, 2020 in Brazil, 552 healthcare workers they died. So what we are looking here, how this is going to become the potential threat for the future. So when we look at the death in the starting 22, we are looking at here 22, and in the end it become 30. So it's not decreasing, it's increasing day by day and month by month and year by year. So if they are not reducing the mortality rate in the future, this is the main potential threat for the future. This is why we are saying this healthcare workers are getting infection. This is the main potential threat for the future.
In outbreak plan COVID-19, we will discuss the project management, system thinking approach, and organizational culture safety. So the coordination and planning, we have to alert all the departments like finance, education, and the transport, and identify the high risk areas to reduce the infection first. Develop the national plans and the prevention, and we have also alert the immigration because it can spread the infection worldwide. Engage community to reduce the exposure, like we have to engage with the community by the social media like the television or regular communication with the social media messages. Yes, but we have to advise them to don't mislead with this social media messages, and we have to give them a regular update. And yes, we can also give them some knowledge about the hand washing, because hand washing is a very important thing to prevent infections, and provide the medical care and reduce the spread of infection, like we can provide the medical equipment and the emergency planning activation and deactivation plan, and make sure the infection risk health facilities. Strategies planning and the coordination is also necessary. Vaccine monitoring and the laboratory testing, we have enough laboratory to testing the samples and testing the samples, and vaccine delivery and the supply is also important, and immunization monitoring is also important factor. The next thing is the project management plan, the surveillance and the response. Surveillance system is very important because we have to monitor the cases and gather data every week from the laboratory or hospitals or from these airports or departure and the new coming flights from the other countries, and they treat and the laboratory mobile tracing. We can do the mobile tracing. It's a best idea to not the distancing which are followed by the people or not, and we can trace the traffic as well. And testing policy and the practice implementation, national test policies, we have provide antigen testing policies, COVID antibody testing policy. Infection prevention and control, make sure that every health worker wear the mask and PPT. It is very important to reduce the infection, and manage the PPE stock. It is very important to reduce the risk of infection, and the proper training. And the case management is the follow up the case probable case monitoring the percentage of the cases which was tested for the COVID, and the training in the case management for the HCW. The next thing is the system thinking. So in the system thinking, the one case was noted in the Australian government Department of Health, and they just did the process and they inform all the staff members, and they decide to give the proper and enough PPE training and PPE for the reduce the infections, and they also appoint the infection control specialist for that. And the outcome was the health department of Australia has declared the outbreak was over on the 7th of May. So that was a good outcome they get. The system thinking, and there is many other types of system thinking. It is the root cause analysis, health organization. The second one is the selection of and the focusing on the strong leverage areas, and designing or redesigning, continuous learning and the improvement.
Organization and cultural safety. This is one of the outbreak plan. And what is organization and cultural safety? This is the safety for the organization. They give more priority for the safety, even for the patients and workers and all other stuff whoever they are working in the organization. Here we are going to look at how we are going to improve the safety. Here, effective communication and cultural of safety leadership challenge. The first thing, inform all the staff about the pandemic situation and make them aware. Don't make them panic, and ensure two-way communication. Your communication should be good both sides, even from the patient side and the staff side. Update the implementation about COVID-19. Give an update each and every day what is going on. So this is the most important thing when we are making outbreak plan. This is going to improve our safety culture in the organization. Also visit the workplace and keep update to the COVID-19 new ideas and speak when we have concern. These are the important things to look after in organization cultural safety. Here we are going to look at the evidence-based national and international standard for healthcare professional for in this infection risk management. And Healthcare Disability Service Infection Prevention Control Standard. This standard name 81422000. Under this standard, there are many national standard which New Zealand Ministry of Health has given. The first one is perform 5 movement of hand hygiene, which is from the World Health Organization. The second one is appropriate use of personal protective equipment. Third one is equipment and environment regular cleaning. And also needle stick injury should be documented and do the follow-up. Then they can improve the quality if they do all the things. So this is the national infection prevention standard from New Zealand. And the next one is international standard. Place a signboard in aged care facilities in front of whoever they are coming. They have to put the sign, and then only they can come inside. So according to this monitor, then we can evaluate the cases in the future. And maintain the physical distance when it is possible while working with the patient for healthcare workers. And healthcare worker must wear mask always when they are doing work, and notify the health department if any concern immediately. And pre-testing for COVID for the patient or the staff is going to be really helpful to find the diagnosis early. And this is the national and international guidelines. Here also, patient shots should not be documented without removing. Some of the nurses, what they do, while they are doing work, while they wear gloves, they go and do the documentation. So it has to be avoided. Like that, unopened food and room entrance should be clear instruction method, and provide PPE requirements and HCW, follow the infection control measure all the time when they are working, and keep the suspected patient in the negative pressure room. Negative pressure room is important, which is called isolation room. So in order to reduce the infection. And international guidelines, healthcare professional must use the N95 mask and personal protective equipment and eye protection and aerosol procedure, which I explained before, the same thing. Limited the visitor and managing. So these all the things is going to be helpful for our outbreak, which we prepare, which we explained in the previous outbreak. So it's like the one example I can give, communicating to the community. So this is going to be helpful according to this international guidelines for our outbreak plan, and this will be applied for our healthcare professional as well.
This is a PDSA cycle which comes under the evaluation strategies. PDSA means the plan, do, study, and act. According to the Marmar research on one aged care, on the healthcare workers, they do not have the enough PPT to wear and lack of understanding about the PPT. They do not have the enough knowledge about the pathogen and viruses and the transmission, and they like management try to improve the quality of this, and they try to identify the new risk, and they also improve the manpower to reduce the stress of STW, and they do all the small study and the quality survey as well. They send all the health workers to the COVID testing if they do not have the symptom. Then still collect the data about the result and give importance to the community spread. And they act like the lockdown, and they also do the social distancing. So this plan, do, study, and act will help to improve our management plan and act like this. There is also evaluation strategies. They use a digital epidemiological surveillance to collect the data from the hospitals or from the laboratory, and as well from the testing units, which where the people doing the test of the COVID, and this evaluation strategies will indirectly help us to collect the data, and this according to this data we can improve our management plan as well, and we can act on this, and we can overcome the transmission of COVID, and which will give us the positive population outcome. This is end of our PowerPoint presentation.
Thank you for watching our video.